bringing one of our official sites online, Buffalo. We're working through that right now. We do have, I just want to do a quick check-in with the different locations if we could. New York City.
Here.
And Stuart, is that you?
Yes, it is. I'm the only one in the room.
Okay, thanks, Stuart. Do we have anybody in Central New York? I don't think we do. Long Island? We have Lynn in Long Island.
Hi, this is Jerry. I'm on, but I'm not in Long Island.
Jerry, are you remote though? Are you virtual?
Excuse me, I can't hear you. I'm not in Long Island. I'm not in the,
Right, you're virtual. Okay, thank you. All right, and I believe we have, is Buffalo on yet? All right, would you just do a quick roll call, to determine whether or not we have quorum? Shamika Andrews?
Here.
Hi, Shamika.
Hi.
Jerry, we heard from you, I believe.
Here.
Dan Brown? Janice Chisholm? Donna?
I'm here. Hi, Nick.
Hi, Donna. You're virtual, right, Donna?
I'm virtual, yes.
Barb DeLong, Buffalo. I know Barb is in Buffalo, so we'll.
Go ahead and press it. Yeah, we're here.
Oh, great. So you can hear us. Good. Randy D'Antonio? Stuart, you checked in from New York City. Jeff Fox is here. Gary Goldstein. Susan Hetherington. You're in Buffalo, right, Susan?
Susan's here.
Oh, great. Thanks, Susan. Paul Joslin's here.
Thank
Suzanne,
you. You're welcome.
Suzanne? No, John Maltby is out. Dolores is here. Deb McGinnis.
I'm here, Nick, but unfortunately I'm virtual.
Okay, thanks, Deb. Missy Miller, I believe, is out. She RFP. Robert Potofsky.
Is he still on it? He
Randy?
works for general counsel's office.
Oh, so he's probably, yeah.
Yeah.
Randy's here. Kai Roman. Sumantra. Lena Schmidt. Michael Seawriter is here. Stephanie Speaker. Yeah. Leah Steinberg. Valeria Valdez. Meyer Wertheimer. Melissa Stickle.
Good morning.
Morning. And Melissa, are you joining us virtually?
I am. I'm in upstate New York.
Let's see, we've got Kirk here, Ray, Tom, Gail, and Terry Hamlin.
I'm here, virtual.
Did I miss anybody? Right. Well, thank you again for all joining us. We do not have a quorum today. So today will be an unofficial meeting. But we will go through the meeting agenda. We are being joined virtually by the commissioner. And we will take public comment at the end. So we'll start the meeting and put up the agenda. Thank you. And again, I'd like to thank the public for joining us. We distributed the minutes, like a motion to just approve the minutes.
Can we do that? No, we can't. We don't have a quorum.
Well, that's true. We don't. You're right.
Yeah.
Good catch. Okay. So we did distribute.
Next meeting. They appear to be in order.
Okay, very good. All right, we will push that out to the next meeting. Very good. Commissioner Neifeld.
Good morning, everyone. Can you see me and hear me?
Ken.
Okay, good. Sorry that I'm not there.
Not hearing very well in Buffalo, just so you guys know.
I will do my best to speak up, Barb, and hopefully that will help. I'm sorry I'm not there in person. I'm just a little under the weather, so I'm joining you from home. And I will most likely drop after I've shared my update and we've had a little discussion. I know that Willow is there in the room. I can't see most of you, but it was good to hear the roll call and hear who's in the room. I do want to acknowledge, just take a moment at the top to acknowledge, I think probably everyone has, read or learned. Last week I announced that I will be leaving the agency in June of this year, end of June. And, as I sort of discussed in my announcement letter, it was, a terribly difficult decision for me to make. I am just, intentionally choosing to step back and spend more time with my family, but want to emphasize that I have loved almost every minute of being the commissioner, and will be there until June, and will continue to work hard, and have all the faith in the world in the OPWDD team, and the group of people that work on behalf of those with intellectual and developmental disabilities, the whole community, self-advocates, families, providers, obviously this council and its committees. So thanks everyone for, everyone's had very generous and kind things to say, and I appreciate that. And we have several more months to spend together working side by side before I leave. So just wanted to acknowledge that. Actually, I didn't want to acknowledge that, but I was told it would be weird if I didn't. So I did. I also want to just make one quick comment about how much I have appreciated over the last, I would say, year, 18 months that, we have been working very closely, the agency and the DDAC, to really align our goals, to align the process that we have with making sure that the committee work is aligned with the strategic plan and vice versa, that the strategic plan is aligned with the priorities of the committee. We have what I think now are really great functioning committees where we have representation from both our strategic initiatives team and our program teams, showing up at every committee meeting. We're forming subcommittees to dive into some of the more detailed issues. And I'm really pleased and gratified to see that happening and want obviously to see that continue. I do want to say that, as the commissioner and the head of the agency, and I'm asking my team to work really hard to participate here. And actually, as an agency, we're really directing the public as well. If they have questions, comments, ideas, we're really trying to funnel a lot of that energy through the DDAC to recognize, the statutory role that the DDAC has in advising the agency. And I want those committees to continue to function really well. And to me, that comes with an expectation, of basic decorum and basic respect at every committee meeting, both from the agency to the committee members and back from the committee members to the agency staff. So I just want to emphasize that and emphasize how proud I am of the work that has continued to happen, and hope that we can continue to work. I know that sometimes we talk about issues that are intense. They mean a lot to us. They're emotional. We have strong opinions. We should have strong opinions. We should disagree. If we're not disagreeing, then I think we're not functioning, right? So it's not a difference of opinions that is the problem. It's just how we're treating each other when we're having those discussions. And I just want to make sure that it's out there that we're all approaching this, as passionate advocates for people with developmental disabilities and wanting to do the right thing. And that we're all kind of coming with that basic respect for each other's positions and treating each other the way that we would want to be treated. So just wanted to say that at the top, and then I'll get into some more specific updates. I'll spend a little bit of time talking about the governor's executive budget proposal, although I know that many of you have heard the highlights. There are probably some who haven't, so I'll go through that quickly. And certainly if there are questions, we can get to that during the discussion. I think at this point, everybody knows the governor released her executive budget proposal at the beginning of the year. And currently we are waiting now for both the Senate and the Assembly to issue their one House proposal. So the Senate and the Assembly will take their opportunity to sort of share their priorities for the state's budget. And then negotiations between the executive, the Assembly, and the Senate will commence, and will hopefully end with an enacted budget at the beginning of April. So we're sort of midway through the process. I know there is a lot of advocacy happening right now around our budget. And obviously, we appreciate that. I do think that the governor's proposed budget continues to demonstrate her commitment to people with developmental disabilities. It increases funding for OPWDD's budget overall by nearly 5%, bringing us to $5.1 billion. Those are our state dollars. As many of you know, we're heavily funded by Medicaid, so the vast majority of our state dollars are matched, by the federal government through the Medicaid program, which almost doubles the budget. We think that the budget aligns, really well with OPWDD's strategic plan. Our primary goals of strengthening the workforce, increasing opportunities for employment and independence for people with developmental disabilities, and increasing access to services for people who are new to our system. The budget does also include some efficiencies in the form of an adjustment to the CCO fees. It reduces the CCO fee by 4% to align that fee with existing current costs. The top agency priority is our workforce. I know it's something that we talk about here at the council frequently. The budget takes several actions to continue to support provider agencies to support our workforce. There's nearly $47 million in this year's budget to support a 1.5% cost of living adjustment. As you know, this is the third year that Governor Hochul has included a cost of living adjustment in her budget. So this builds on the 5.4% increase in 2023, and it builds on the 4% increase in 2024 for a cumulative increase of nearly $1 billion to OPWDD provider agencies over the last 3 years, assuming the 1.5% passes. This year, we're also required to do our federally required rate rebasing to update and reflect the actual costs of delivering services to our providers. So this year's budget also includes $79 million to recalculate provider reimbursement rates. And if you add that to the COLA, it provides an increase of more than $480 million when you factor in the federal share as well, which is a significant amount of money going to provider agencies over the course of the next year. The budget also includes $45 million to support minimum wage increases, including the indexing of minimum wage to inflation. And it includes funds to provide targeted rate enhancements to our Article 16 clinics, as well as our CSIDD, our crisis services for individuals with developmental disabilities. And that's work that we'll be undertaking with the Department of Health to review those rates and understand what investments are needed. This year's budget continues to increase opportunities for independence and employment for people with developmental disabilities. We're excited that for the second year, Governor Hochul has included a legislative proposal that will allow greater flexibility for the performance of certain nursing tasks by DSPs. This would allow for the first time DSPs to perform certain nursing tasks in the community, which we believe will help people live more independently. The example that we use frequently is medication administration, where we'll hear about someone who otherwise could live independently in the community. Perhaps they have a job, they navigate transportation, they have a ComHab worker that helps them, but they struggle with administering their own medication. And we know that it's difficult to obtain nursing services for some of those simple tasks. So we're hoping to create an allowance where DSPs, after they have been trained by the family or the individual, would be able to administer those medications and increase the opportunity for independence for people. This year's budget also includes $3 million to establish home enabling supports as an assistive technology service. This is something that we included in our waiver amendment that was approved in October, so it is now an approved waiver service. And this year's budget includes money for us to begin to start these services up across the state and see how home enabling supports can help contribute to people's independence living in the community. I think we've all seen really exciting examples of the way that technology can impact people's lives. And we're excited to see what services we can provide and include as a waiver service. As the budget has done since 2016, this year's budget also includes $15 million to expand our integrated supportive housing program. So another year of funding for the ISH program, which brings us to a total investment of $140 million into ISH since the program's inception in 2016. We're particularly excited that in both her State of the State and in her executive budget proposal, the governor supports employment first as a set of interagency principles that really set the goal of employment as the first option for people with disabilities. In her State of the State, she committed to signing an executive order making New York an employment first state. That gives us the opportunity to join a very small list of other states across the country who have this philosophy and put this philosophy out. And in her budget, she included almost $7 million to help us fund this initiative and really begin to see a transformation in the way that we approach employment opportunities for people with disabilities. Thinking about, those funds will provide opportunities for grants for disability service providers to do things like train their staff, to have, meaningful relationships with businesses in the communities, to help, make employment opportunities a reality for people with disabilities. And also we're excited because the governor included a $1 million funding increase to Special Olympics New York, which provides inclusive sports training, skill building, and competition. And they also offer free health screenings and health education to people with developmental disabilities. In accordance with the third goal of our strategic plan, increasing access to services, the governor's proposed budget includes $60 million in new state resources to support new service access. So this is people who are entering our system for the first time, people who are already receiving services and whose needs may change. A few years ago, we committed to updating our housing subsidy to mirror the fair market rent levels. These are all the areas that we use that $60 million in new funding to invest to continue to make sure that we can provide services. We also use it to address emerging issues, looking at costs associated with people who are aging out of residential schools, creating new programmatic opportunities to serve people's needs. The governor also invests $250,000 to update the Olmstead Plan. Some of you may know New York's Olmstead Plan was drafted in 2013 and hasn't been updated since that time. But this year, the governor has hired a new Olmstead director who's working directly for Kim Hill in the governor's office, directly under the chief disability officer. And she'll be working with the Most Integrated Setting Coordinating Council, the MISC. Some of you participate in the MISC, to update the Olmstead Plan, which is also another opportunity to improve access and inclusion in the community for people with disabilities. A few things I want to mention that are not included in the budget, but we're very excited about, and we have a little demos to show you related to our ARPA project extensions that we are going to continue to fund. We have had a very successful, and we've talked here at the council, very successful partnership with NADSP, the National Alliance for Direct Support Professionals, and SUNY to provide credentialing and micro-credentialing to DSPs across the state. We recently celebrated our 1,000th certified DSP. I think we're actually closer to 1,100 at this point. And there have been many DSPs who have participated in the SUNY program as well that have really benefited from the micro-credentialing. You can see we're trying to show you a little video vignette here so that you can hear directly from some of the DSPs who have gone through the eBadge Academy. Another exciting piece is that we will be beginning to offer this micro-credentialing to state operations direct care staff as well. We work closely with CSEA to make this an opportunity that's available to our state operations staff as well. And we'll be continuing to fund this venture We are investing an additional $60 million over the course of the next several years to continue the credentialing opportunities. So I'll stop and hopefully we can get the presentation up. Or do you want me to continue and we can show it after I'm done talking?
I think it's only for us, but let's do it. Sorry. Folks online. It's in the phone.
Commissioner, while we work on that, maybe just keep going. Okay, I'll do that. The other piece that we're excited about is the statewide marketing and recruitment campaign. We have contracted with Vibrant Brands, which is a local to Albany area marketing firm, and we are creating a marketing campaign. It looks like Janice, you've come off mute. Do you mind muting? There's some feedback coming. Thank you. So the marketing campaign will benefit both the voluntary and state operated programs, and we're launching that later on this month. We've created that through a collaborative of providers, DSPs, people with disabilities, their families, and the OPWDD staff. We're very proud. We'll also show you, a preview of one of the commercials that's been produced as a part of this recruitment campaign, if we can get that working. But we'll be launching that in the middle of the month. And we have close to 200 providers already participating in the website that we are building to support this effort. And we're very excited to launch that and also be able to continue that for multiple years. So maybe we'll scrap the videos and just send them around to the council members. Does that sound like a good idea? Okay, we'll do that. We tried. We wanted to be interactive and show you the exciting stuff, but we will send it to you via email. Apologies for that. There were a couple of other updates that people wanted to hear that the council asked for updates on. So I'm going to share some additional updates there. And then we'll open it up for discussion. I know that health and wellness continues to be a topic of interest, both for the committee and just generally speaking. Wanted to update that we have been working closely with the Department of Health to raise awareness of health disparities and issues with healthcare access for people with developmental disabilities. We recently took part in a Commissioner Grand Rounds with the Department of Health, as well as a DOH Public Health podcast. The Governor's State of the State also included expanding the Department of Health nurses across New York program to both the behavioral health and OPWDD providers. So this is a great opportunity to recruit nurses to our field through a tuition reimbursement program that the Department of Health started last year. This program has recurring funding and a new opportunity will be released this year that we'll be part of. We're very excited. We also know that the Department of Health's budget included a $10 million increase to the reimbursement for Article 28, which are hospitals and hospital-like settings that are serving people with disabilities. So that will create an increase in rates that will hope to incentivize, better access to care and better care overall for people with disabilities. As I mentioned earlier, the budget includes enhanced funding for Article 16 clinics and crisis services, and we're partnering with DOH to explore how we can better integrate Article 28 and Article 16 evaluations or clinics. An update on the self-direction evaluation, which I know the self-direction committee is very interested in. We will be launching the self-direction evaluation shortly. We're in the beginning stages of ensuring that the contractor's work plan aligns with all the objectives that need to be met. And we will provide updates on the next steps once the work plan is finalized. I also want to emphasize that much of the feedback that we receive from the self-direction community and the self-direction committee was used to form the RFP that is guiding our engagement with the contractor. So you should expect to see many of your priorities included in that work, and for the DDAC committee to play a role in providing feedback to the contractor once they're up and running. Just an update on the managed care review assessment study. That report is due to the agency this spring. Thank you to the DDAC for your participation in the development of the report last June. I know Guidehouse presented to this group and received feedback. A summary of stakeholder feedback from the town hall sessions was posted to our website late last year, along with the posting of the Guidehouse Managed Care Survey for people with developmental disabilities, their families, natural supports, and providers. The final report, which, as you know, is done independently by Guidehouse, will also include a summary of the stakeholder feedback and will be available to the public once it is released. I want to just continue to stress and emphasize that OPWDD has not yet made a decision on whether or not to utilize managed care for HCBS waiver services or in general for people with developmental disabilities. The evaluation is just one step toward helping OPWDD understand if managed care or other models would help us to better meet people's integrated care needs. The result of the assessment will just inform our next steps, which will include many opportunities for dialogue and engagement prior to any decisions. Excited to mention, as we've talked about here, that we have been opening comprehensive adult transitional homes since 2023, which is a part of our plan for helping to transition young adults out of residential schools and out of state schools. We opened one home late last year on our Bernard Feinson campus, and we opened another one in Brooklyn earlier this year. And we also plan to open 5 more sites throughout 2024, which we can keep this group posted on. I also want to say that I know the Housing Committee submitted formal recommendations last spring to the agency. And I want to just thank folks for your patience. We at the agency actually didn't have a formal process. I know that there's a formal process for the DDAC to submit recommendations to the agency. We did not have an agency formal process for responding. So we are committing to responding to recommendations from all committees in writing. And we will begin that with, our response to the Housing Committee, which we will have back to you certainly before our next DDAC meeting, but hopefully in advance of that. So going forward, you can expect that commitment from the agency and appreciate, your time and patience as we have formalized that process internally. So I think that that's it from me, and we will get you those videos because some of the information in there is exciting, and I think you guys will really enjoy seeing it and seeing the progress that's being made with the NADSP work, and also on the marketing campaign. The material that's being created there is really beautiful. So that's it from me. I'm happy to answer any questions or have a discussion about anything that I shared this morning.
Thank you, Commissioner. How much money is being dedicated to the self-direction survey?
I don't actually know off the top of my head the value of that contract. Can certainly, look and let you know. Also, just want to emphasize that the self-direction survey funding, what came out of our ARPA funds, it's not part of state dollars. It was ARPA dollars, one-time funds that were used to fund that survey.
Commissioner, we have a question from Jeff Fox.
Hi, Commissioner. I'm sorry if you said this and I missed it, but are we on target for the Guidehouse report to come out this month?
It will come out this spring. We're still working on that being finalized by Guidehouse, and once it's received by OPWDD, as you know, we have internal vetting and vetting with our principals. But we are on target to receive it this spring, and we'll be releasing it to the public as quickly as we can.
Additional question. You spoke of a comprehensive adult residential houses in Brooklyn. Can you explain what that concept is and what the plan is on that?
I think you're referring to the comprehensive adult transitional homes. I talked about one in Queens and one in Brooklyn, and the plan to expand statewide across the 2024. The comprehensive adult transitional homes is something that's part of our strategic plan, and it's something that state operations is developing with the goal of helping young adults who have graduated from residential schools, either in state or out of state, to transition into OPWDD's adult system. I think we know, and I think providers who work closely, with the residential school population, understand that residential schools tend to be a much more restrictive environment. And for some young adults, it can be difficult to make the transition from that environment into community-based living. So we're working on what is a transitional home. It's meant to be 18 months, really with the goal of being there for a short period of time, while the individual works towards greater independence and more community-based living. And I took my video off, just so you know, because just for bandwidth issues, wanted to make sure you could hear me, more important than seeing me.
Commissioner, we have a question from Gary Goldstein.
Hi, Commissioner. Will the Guidehouse report on potential transition to managed care include medical and dental and services, or just for other services? Is this something that's being combined, or is it a separate discussion?
They've reviewed the opportunity to transition all services to managed care. So it's not meant just to look strictly at the long-term supports and services through the waiver, but really the whole, sort of the whole picture of an individual's healthcare, and if and how managed care might benefit the provision of those services.
Going back and forth between residential and managed care, but I'm back on residential. I appreciate and applaud your recognition of the need for transitional services. Has there been any effort made to have the residential schools develop group homes or independent living? I'm hearing from a lot of the agencies that they have overage people and they have nowhere for them to go. Is there any way for OPWDD to combine with these schools and try to solve some of the problem that they're facing? They're not necessarily licensed or authorized to keep these young people, but they're living there. And now they're looking to say, well, if we're going to have them, we're having problems with the funding. Is there some way we can establish some kind of a program for them to continue to provide services for these young people, at least until they find something out in the community?
So I know that Abiba and Willow are on, and they can jump in to add anything to my answer. But we do many of the providers who provide residential school services are also providers in the OPWDD adult system. Just last year, we released an LOI, a letter of interest, as an opportunity for development for youth aging out of the residential campuses. And both last year and this year, we provided financial incentives for our providers to develop or use their existing capacity for new opportunities for these young adults to help make that transition. while they remain on the residential school campus, they do receive services from that residential school provider, and we do pay for that from OPWDD. So although it's not the ideal location for them to be, while they are there, they are receiving services. And we do work really closely with both the residential schools and our providers to make opportunities available to those students in advance of their graduation date. And certainly for those who have graduated and remained on campus, work very hard to identify those opportunities. Like I said, including, generous financial incentives to help pay for some of the extra costs and some of the extra training that might be necessary. And just want to give an opportunity for Abiba or Willow to fill in any blanks there if I missed anything.
Commissioner, you're correct. For the past several years, we had actually worked with some of the residential school providers who are also OPWDD providers to develop a process where the residential schools are able to work with our regional field office staff and certainly the families to identify any individuals they're able to support or interested in supporting prior to sort of the broader LOI being issued. And that was really done in partnership with the residential school providers, recognizing that they've been supporting individuals for 5 or 6 years and certainly have a better understanding of their clinical needs and profile. So that's an ongoing engagement that continues.
Commissioner, that is very good. I appreciate that. I'm talking in particular about those who have never been providers for OPWDD. Is there any way that we can reach out and expand the program you have now to try to bring more of these others in, those that have never been working with OPWDD before, but now find they still have some young people? And I think that's, try to get them into the program that you already have as an OPWDD provider.
Yeah, I think we evaluate constantly, our regional offices are evaluating constantly whether or not we have a need for additional capacity or additional providers. And I think what we find right now is that our efforts are best spent in developing the capacity within our existing providers rather than bringing on new providers and really, working to make the transition for those young adults to an appropriate OPWDD service provider if they're being served by a residential school that doesn't have an OPWDD footprint. And again, Abiba can share, but it's our regional field offices really have their finger on the pulse of what each community needs. And we do, expand and bring in new providers or new opportunities when necessary, but we're not seeing that that's really the place that is needed right now.
And I think if I could just add, Commissioner, I think the idea, just to drive the point home behind the transitional housing, is to try sort of a new model of taking some of those young adults and providing the more intensive services to try to transition them to a point where they can be moved into the community instead of needing that higher level of care forever, right? So, you can try the same thing over and over and try to spend more money on it, and at some point there's new models as the safety net provider, the state trying to create the new transitional housing to see if we can sort of move the mark a little bit.
I'd like to survey the remote sites as well as those who are participating virtually for any questions. Kirk Lewis.
Thanks, Nick. Commissioner, I just want to, as a former provider and a brand new member of the DDAC, thank you for your service and what you've done and the environment you've created for positive feedback. I'm not taking it personally that as soon as I come on the DDAC, you've resigned. But, I think one of the reasons I was excited to do this was the role that the DDAC has and the way that you and your administration have treated it. And I'm sure that's going to continue. I'm sorry that you will be leaving soon. But again, thank you for what you've done for the field.
And I believe we have one more meeting with you, right, Commissioner? We have June 11th.
Yep, we do.
Okay. So we can have part.
You'll at least get a little overlap there,
Yeah.
Kirk, okay? Okay. Very good. Any other discussion? Gary?
Am I on?
Yes.
I also want to applaud your efforts at interagency cooperation. regarding healthcare and bringing some of the topics of importance to Department of Health and raising awareness. At some point, we look forward to that becoming a tactical plan, perhaps, where awareness is raised, but what is the next step to see it actionable so that people are seeing the results? And I look forward to further hearing about those items as we go forward.
Absolutely. And we are beginning those discussions. And I think we're very lucky to have incredible partners at the Department of Health who are really invested in this space with us.
The Grand Rounds session went very well.
DOH just told us last week that that was the most attended grand rounds that they have had, which is incredible.
It's great. Wonderful. Any other discussion? Commissioner, we thank you for joining us this morning. We know you're under the weather. I think you're going to probably be signing off, but we're here with Willow and the rest of the team. So
Great.
thank you very much.
Have a great meeting, guys.
Thank you. Okay, now we're going to move to committee reports, and we'll start out with residential. Paul, are you doing? I know we don't have John with us, and
So we're residential.
we've got some transition. right,
Yeah,
right,
yeah. And so and one of the issues that we discussed was the commissioner addressed in her comments was the recommendations that had been made
Right.
Last spring and then formally passed by the DDAC to the commissioner in the fall. So we did hear at our last residential committee meeting some discussion about addressing those recommendations. And I think we're very pleased to hear that the commissioner's going to formally enact a policy responding to recommendations that come, whether it's residential or otherwise, in writing. So the other thing, I will be, I'm brand new to this, so
Yeah, and I apologize, Kirk. I should have announced, we do have some changes going on with the committees, and that Paul is now going to be joining Gary as the co-chair of Health and Wellness. And we've got Kirk and Dan Brown leading residential. So I should have said that.
So, thanks, Nick. And we will be, I'm going to be reaching out to the committee list, setting up further meetings, working with Paul just to make sure we carry over the initiatives. I know there's several very active subcommittees, but we'll look at continuing that. One of the things that Paul and I discussed that would be helpful to me and may be helpful in the future is trying to develop a charter for the committee just to outline what the committee is going to do, where it's going to go. So again, I appreciate everyone's assistance. I know we've got a lot of great people with input on that. Tom, the issues you raised, I think, go right to the things that can be addressed by a residential committee, because I think the concerns about placements for residential schools cut across the ability of the provider network to meet the needs that are out there. And they also cut across the issue of high needs, individuals with complex needs, and how do we meet those needs? So again, more to come.
Nick, if I could just add that besides the committee that created the recommendations that the commissioner referenced, we have two very active committees, or the residential committee has two very active committees. One focused on a housing policy for the next decade, and another focused specifically on certified residences, both in the state operating system as well as the voluntary provider, and getting feedback from families and other stakeholders of people who live in those homes.
I think you kind of answered my question. I was going to ask, what is the purpose of the residential committee? And it sounds like you're dealing with both the certified residences and independent living.
Yes.
And I think having some kind of a statement of purpose would be a good idea, like you were talking about. The residential issue, I think, is one of the biggest issues right now. I'm still hearing from people about abuse in group homes, and how long it takes for a response from the Justice Center. I don't know if the Justice Center is part of our charge or not. It is not. Is there an advisory council for the Justice Center?
Yes.
There is one? Okay. And as far as independent living, I heard from some of the residential schools that they have lots of young people. And I know of one that was trying for a long time to establish a residence because they have an extra building on their campus. And I don't know if they've been successful but they're not part of the OPWDD system now, and it doesn't sound like OPWDD is ready to reach out to them. So I think you're right on target with addressing that very issue, because that's a place which is safe for people. The young people have gone through the residence there. The staff knows them. They're comfortable on that campus. Why not give them a home on that campus and let them stay there for maybe forever? Why are we saying, no, we can't use that campus? So thank you for taking a look at that. I would like to be on your committee. If you can add my name.
I'll reach out. Yes. Thank you.
And again, this is the list currently of committee members. Anybody who is interested in joining, reach out to Kirk and Dan.
Nick, if I could just add.
Sure,
I don't
Paul.
have the data in front of me, but I believe over a third of the existing committee members are family members of people who live in residences. So
Right.
it is a committee that's well represented by that important stakeholder group.
Right. Thank you. And that's to your credit and John's credit. Great, thank you. Let's go to Children's Services Committee. Jeff and Randy?
Yeah, hi. So we met back in January. At the end of January, we had representation from OPWDD there. So we reviewed the 507 plan, and the OPWDD reps talked a lot about the progress that they've made towards the strategic plan. And it crossed over into discussions about some of the concerns that the committee had in a number of areas, particularly as they related to transition services, children's access to ComHab and respite, crisis services, denial for enrollment to the waiver, and difficulty for families finding providers and even accessing those services and knowing where to go. So, you know, it was our initial kind of meeting and discussion with OPWDD, and it was a good conversation and a lot of discussion about cross-system collaborations, which we think will be really helpful. So we already have a meeting scheduled for the, I think, mid-April or so. So we're looking forward to continuing that conversation and then coming up with some recommendations.
Great. Great update. Thanks. Let's move on to Health and Wellness. Gary, and now Paul again.
We covered a few topics just a minute ago with the Commissioner. See, Jill is here. Asked her as I came in, are there any plans or perhaps expanding state-run Article 16 clinics to access and places? Some of our issues are, you know, we know that there are issues. We know that finding services, medical, dental, health.
I'm sorry to interrupt, but Buffalo can't hear anything. I don't know if anyone's speaking or we just got cut off.
Is it now?
A
Okay,
little
so-
bit we can hear.
So
Maybe
we
speak
addressed,
Closer to the microphone.
so I'll start over.
That's better.
The commissioner addressed a few of the items that we're concerned with regarding medical, dental, behavioral health services. And there's a lot of plans and there's attention to it, but we're not yet seeing like reality on the ground of improved services. And it comes down in part perhaps to tactics. I know that, you know, there was, for example, a paper circulated talking about people with complex needs, with complex behavioral issues being stuck in hospitals for a long period of time with no place to go, and some interagency cooperation issues. So they're identified, you know, and we could make recommendations, but a lot of times it comes down to, is the money there and are there tactics in place? Is the system changing to improve? There are things going on that we on the committee may not even know about. And so part of my answer, you know, part of my purpose today is just ask a few questions and see whether or not certain items are being moved forward. And that will help us inform perhaps recommendations going forward. For example, the state-run Article 16s. I don't believe there's any particular plan, I was under the impression that there was going to be an increase in the budget next year proposed to fund the Article 16s with a significant increase in reimbursement. But I hear this and I don't have it as a fact. Will that help? What's the anticipated help in providing services? And is there any kind of coordinated effort to say these are the services needed in certain parts of the states? We have a clinic here. Can we place services there? So that's one question. And so Jill, I don't know if you want to answer, but sorry to put you on the spot.
Jill, it would be helpful. Some people do not know what an Article 16 is, so if you could kind of just give a quick overview.
Okay. Good. No, you're fine. So thanks, Gary, for those questions. And an Article 16 clinic is essentially an OPWDD certified clinic where different therapies are provided, most commonly occupational therapy, physical therapy, speech language pathology, psychology services, social work services, things that are more habilitative in nature. We also do offer some medical services within Article 16 clinics. But again, there is a range of options available at any given certified Article 16 clinic setting. So to the question as to whether we're expanding clinics or whether there's a push to increase the availability of clinic locations, we have only had one, actually, I just checked this after Gary asked me the question earlier, one recent submission, I think it was in 2022, for a submission of a certificate of need to start up a brand new Article 16 clinic. Prior to that, we've had really modifications made to certificates of need to increase locations of clinic services or to reduce clinic services because perhaps a clinic has lost certain key clinicians that were delivering certain services. We've also recently engaged in some survey activities with all of our Article 16 clinics to understand truly what are the available services that they are currently providing, because there's been a great deal of change as clinics have lost key licensed or certified professionals to deliver things like physical therapy or occupational therapy, such that we think a clinic is offering those services, but they haven't had a provider, a clinician, to provide those services for the past 3 years. We show they have it on their operating certificate. We're sending people there when we get referrals. We're finding out now they don't have those services. So again, we have undertaken some survey activities just to get a better landscape of what services are currently really available at those clinic locations. And in so doing, again, we're making some adjustments to those operating certificates where needed so that we can have the correct information and get people to places where they can actually receive services that they need. To the point as to whether there is an increase in resources to fund clinics, again, I'm not the fiscal person at OPWDD, but we certainly are working very closely with Department of Health, who really does set the rates for clinics, and it's through the APG methodology, the ambulatory patient groupings, I think is what the acronym stands for. So those rates have not been updated in a number of years. So that's an active project that, again, we're partnering with the Department of Health to facilitate an update to those rates, because we agree that there are concerns with the rates and the adequacy of the reimbursement that's being provided to the clinics. But again, OPWDD does not set the rates. So it's a partnership project. And we provide updates around these types of topics regularly through a work group that we have with Article 16 clinic providers. I loosely call it our Article 16 clinic provider group, association group. It's not the same as our provider association group, but nonetheless, we have regular and ongoing discussions with that group to provide updates, to gather information, and to facilitate dialogue to make sure that we're addressing as best we can the concerns that are being raised about the operation of our clinics. We can't solve everything. We have a number of regulatory amendments underway. Again, things take time. We're actively engaged with our teams to continue to move these projects forward. I would love it if we had more clinical resources that we could hire at clinics, because that would truly address the challenges that we're all facing. Even within our state-operated Article 16 clinics, we have had a loss of clinical staff
that have reduced our capacity within state clinics to deliver key clinical services, notably dental services, Gary, which I think you're quite familiar with, where we've had challenges with recruiting dentists to do the work. So we also have a number of other conversations that we're engaged in with other partners to look at how we can increase resources in some of those key clinical areas and medical areas to develop expertise to, just again, have more capacity within the system. So all active and ongoing discussions. Unfortunately, it takes a long time to grow a new dentist or a new psychiatrist, for example, because and having then how do we interest those people in working with our population? And that was one of the notions behind doing the grand rounds with Department of Health, was really to just put information out there, expose a larger audience to the value of working with our population and, how rewarding that work is, as I think was very evident from our presenters that day. So Gary, I hope that answered.
Yeah, good information. And I'm going to ask follow up with a few other questions. So if you can hang out one more second.
No, the APGs are no. So again, I think and I'm not the fiscal person, but as I understand it, there's different weights that are attributed to enhance the rate that are associated with a person having that IDD designation in our billing system. And so, but again, how all of that gets computed has not been updated in quite some time. So that's the work that's currently underway.
About the weighting
The best way to think about it is there's for a person who has an IDD, there's a code in our tracking and billing system that identifies that person as having a developmental disability. And if that person goes to an Article 28 or an Article 16 clinic, there's a different enhancement that's added to the reimbursement. That's the best way, the simplest way I can describe it. I can tell you what that is. Again, it's part of the whole methodology that Department of Health puts together, in terms of how the rates are set. So.
May I ask a question from Buffalo?
Could you just hold on? We've got one in process.
Okay, can't hear you.
I did get a note that it's very hard to hear the questions being asked. They can hear the answers, but not the questions.
Okay, there we go. That's better. Well, what I said was thank you for the explanation. It was very helpful. As a follow-up, can you explain what an Article 28 is? And secondly, you're talking about a lack of money. Do we need to talk to the legislature, or is this internal? An internal push by OPWDD to the Department of Health, or do we need the legislature to add more money specifically for that category? You may not know, but if we can get an answer quickly, we can talk to the.
I suspect the answer is yes.
That we need more money specifically for that category.
I suspect. And whether it's a carve out or it's something.
Well, maybe if we could find out, we might be able to, your subcommittee might be able to push.
We can't. We don't do that. We don't lobby.
You can't lobby. No,
Yeah.
but you have a
So
ability to talk to your own legislator.
Yes, as we've spoken before.
Thank you.
Do you want me to answer the question about the Article 28? So an Article 28 clinic is certified by Department of Health. And that is the primary difference, just as an Article 31 clinic is certified by the Office of Mental Health. The Article 16 clinics are certified by OPWDD. And they do offer somewhat different services across those different certified clinic settings.
Thanks, Joe. Gary?
I could probably occupy this whole meeting with a number of different questions. I don't want to do that. But, we talked about waiting times for operating room, and working the commissioner certainly went to bat and got an increase in funding for that. So there's an enhancement for operating room services. Is it enough? And we're trying to get a survey together to determine whether or not waiting times are actually being affected. Is the enhancement causing action on the part of providers to actually open an operating room time to see patients with IDD? What is being done in that regard? Fortunately, we have a great partner, survey of care coordinators to determine what is happening throughout New York. What are the metrics for health in certain parts of the state? Do we have metrics that are actionable, and that are generally accepted by Department of Health and us? So it's another topic that, we'd like to see developed.
Yeah, and one other thing.
Yes.
Okay, so I know Barb, you had a question?
I do. Very briefly, it's great that the Article 16 and 28s are getting enhanced funding and also ERs or operating rooms that rather. I agree with Gary that we need some measurement on whether that's making a difference. But I do also want to point out that in our effort to get our loved ones out into the community to see typical doctors that aren't in a 16 or 28, or we choose not to send them to, they're still getting terrible reimbursement from Medicaid. And most of those physicians or dentists are doing it out of their goodwill for us, not because they're getting reimbursed, because they get maybe one fourth of the amount of money that they spend time with. Our loved ones need far more time than a typical 15-minute slot in a doctor's schedule. That's all. That's just a comment. That's a Department of Health issue that they need to resolve. Some doctors don't even take people with DD because of that.
So we'll continue this discussion at the next health and wellness meeting. I'll throw out just one more quick question, and that is, when care coordinators can find nobody in their district to help with a medical problem, where do they seek help? Is there somebody above they can go to? Is there a central person that says, you know what, I've been trying to get this service in such and such within 3 hours of such and such a location? Is help, SOS, who do they call? I don't know, because we get calls sometimes from care coordinators that can't find services. And we're volunteers. We're not the ones necessarily that know all the answers.
So Gary, I can tell you that the CCOs do collaborate. They share information if they know of providers. Now, that means that some people may have to travel for those services, but we do connect across the regions to make sure that if somebody has an unmet need, that's not to say though that all needs are met. We know that especially in some of the specialty care areas, dental surgery, psychiatry, behavioral health, those are areas that we all struggle with across the state in finding adequate resources to respond. It's a known issue, right, Jill?
Yep, absolutely. And in addition to what Nick said, we routinely receive questions at OPWDD at our Article 16 clinic mailbox, and we regularly are doing the research and helping to connect a family member, a care manager with a resource if we can locate one. And that's hence the importance of us knowing what services are actually being delivered at all of our clinics. But we also outreach Article 28 clinics, sometimes Article 31 clinics, in our efforts to try to support people in getting connected to a necessary clinical resource. So we're also another avenue. Whenever people reach out to us, we do our best to help.
And I know we're also training care managers to look at, if somebody is qualified for Medicare, making sure that they look at the Medicare network, because sometimes that increases availability, looking at Medicare Advantage plans, other plans that may exist in their geography that might increase the availability of providers, because fee-for-service has some limitations. So again, it's making sure that the care managers can advise the member that there may be other ways to increase coverage when there's a need.
I guess it's a question to you, Nick. Which one of our subcommittees deals with crisis response? Is that Gary, or is that a different one? Well, my question is, how do we better cooperate with local governments that want to set up crisis response? In the mental health area now, they're starting to pay much more attention to that. How do we get those crisis teams to do double duty and have somebody on their team who can deal with somebody with a developmental disability or an intellectual disability. I recognize it would be very expensive to try to set up a separate system, but perhaps we can combine. I do know that in my own county, they're willing to do that, but there's no monies available to do it. And I'm not sure they have the authorities to do it. So
I'm also in DDAC now.
Do you step to the microphone?
Yeah, Suzanne,
Okay.
yeah, come on up. There's a seat right here.
So once again, I'm Suzanne Levang. I'm a member of the council. I also serve in the capacity of a director of community services, the local governmental unit. Currently, right now, with the Conference of Local Mental Hygiene Directors, there is a pilot happening right now in collaboration with OPWDD, developing a mobile crisis team for individuals with IDD. But I can also say that there is a significant need to drill down on those services much harder than we are. I had an email conversation with Jill just last week. I have 2 individuals in Franklin County Correctional Facility with IDD and with mental health issues. One has been there since last November, waiting for services. I have another one who came in, I want to say in the beginning of January, once again, highly assaultive in an IRA, severely injured one of his staff, put her out on medical leave, and that he was arrested and went in front of the judge, and his behaviors escalated to such a degree that he assaulted court officers and law enforcement, and he found himself in the jail. So there's a serious issue we have serving that individual with the highest needs. These are our most vulnerable people trying to live independently in a community or in a community-based IRA. So we have a lot of work to do in terms of supporting these individuals. And I will say that one is served by a care coordinating agency. Not once has that care coordinator been in to see him at the jail. Another is served by CSIDD, and again, has not been visited in the jail. So there are no services available for these individuals other than the mental health services that we provide in the county jail. So it's really heartbreaking to know that for months they languish in our jails without services.
sorry to interrupt so much, but Gary, the legislature, in conjunction with the governor, 2 years ago, expanded Kendra's law to allow for a psychiatric review of anyone suspected of having a mental illness. So divert them from going to jail and put them into some kind of program. The problem with that, one of the loopholes in that, was that if the person is brought in and found to not have mental illness, but instead to have a developmental or intellectual disability, they go back before the judge and then they end up in jail. And one of the things that I would like to see us push for, maybe OPWDD push for, is an amendment to Kendra's law to expand that to include people with developmental disabilities. And if they're found to have a developmental disability, that they get referred for services at OPWDD. Now that's going to put a burden on OPWDD, but it will keep people out of jail. They should not be living in jail just because there's no services. So, I guess that would be Gary's subcommittee again. I'd be glad to talk to you about it afterwards.
How about this, you and Paul are going to be forming a complex behavior subcommittee. So this is certainly something that we would want to discuss in that subcommittee.
Absolutely.
I'm pushing for this for a long time.
Yes, you have.
Yes.
Okay. Any other discussion for health, Paul?
I just want to add that the news that the commissioner shared about funding increases for both Article 16 and Article 28 and a continuation of the recruitment funding for therapists and clinicians is great news. It's overdue, but it's great to see that OPWDD, the commissioner or staff recognize that and are trying to do something about it.
Right. And one of the other things that we discussed is that perhaps for the next meeting in June is to actually have a representative from DOH to maybe talk about the 1115 and what the 1115 could potentially mean for this population, because I know there is some dollars there for especially the area of professional recruitment. So, was there another question?
There was, Gary. It's Terry Hamlin from the Center for Discovery. I just wanted to be included in, so this is only my second formal meeting, but I would like to be part of the Health and Wellness Committee as well as the Children's Committee. I think Jeff is part of that and Randy. And I don't think people realize that we are partnering with OPWDD to open up a children's specialty hospital to treat individuals with really complex medical conditions that also have IDD. So I'd like people to know that, and I can speak more about that from, at the subcommittee meetings. But, it's really one of the first of its kind in the state and definitely needed for so many individuals. So I'd be happy to share more. But if I could be included, that would be terrific.
Terry, we have you on the list for children's services.
Oh, you do? Terrific. Okay. I didn't see it up there. Okay, great.
Children's services, and we'll add you to health and wellness. Did you have a question?
Great.
Okay. All right, let's move on to our next committee report, which I believe is employment and meaningful activity. Shamika and Susan.
Yep, you're on mute. Thank you. This is Susan Hetherington. I first of all wanted to thank Julia, Kelly, Allison, and Jess for their involvement, excuse me, in our committee. It has made a world of difference, and we really have been able to move along. We have been working on coming up with recommendations that meet our mission and vision. Just briefly, because they're not ready to present yet. One is to develop a nonlinear, comprehensive graphic or roadmap or checklist that would lay out the process for moving from school day hab or community hab to pre-employment and supported employment. The other one that we are concerned about is adding a transition plan to every individual's life plan that would include employment, entrepreneurship, and other meaningful activities. And finally, working with OPWDD to make customized employment a clear option for people with disabilities. Beyond that, I want to say how pleased we are that the governor is making New York State an employment first state. That actually had already been done and really had not much success or action in terms of being an employment first state. So
I guess I have a question, if there's anyone there who can answer it, on what's going to be different now in terms of making New York an employment first state.
So Abiba, I know you're on. I don't know if you want to jump in on some of the work that we've been doing to think through how the funds proposed in the executive budget would be spent differently this year than last year. So the executive order last year was to make New York State a model employer, and now this year's proposal would go a step further to make New York State an employment first state. And some of our proposals would move from, I think, the sort of direct vocational training to creating more connections in the community, more mentorships, more collaborations with business. But Abiba, you certainly should jump in.
So I think, our teams have been doing a lot of work in this area, and certainly, Julia is on the team and probably has shared some of this. And Alexis, feel free to jump in. But essentially what we're doing is we're taking some of the work related to the career vocational training, looking at some of our existing policy and practices, and really trying to make sure that there's really this continuum of supports where people are not just looking at some of the more traditional services, but making sure that our regulations, our policies, our processes really support people transitioning into pre-vocational and more employment-specific services and supports. Also looking to make sure that with some of the impacts of the pandemic on service areas that people with IDD have worked in previously, that we're able to provide additional opportunities by making sure that we provide training and skills to be able to support folks to access more integrated employment. And I'll let Alexis jump in as well.
Thanks, Abiba. Yeah, that is exactly what we're doing. I would only add the one little caveat that what we're really hoping will lead our work as a state are some guiding principles related to employment first. And I know that that is really being worked on through the federal technical assistance that we were awarded through NEON. Don't ask me what that stands for. I can't remember right now, but once I find it, I will send it to everybody. But we really are kind of working to identify some key guiding employment first principles for the state of New York so that we're all on the same page. It's obviously not just our service system that would be employment first. There are plenty other, agencies at the table, such as State Ed, Access VR, OMH, Department of Labor, and a lot of other partners. So we're really looking forward to continuing this work and establishing some MOUs with those partners as well.
I really appreciate those responses, and I know how hard OPWDD is working towards this. I think my question, and you may not be able to answer it, is that under Cuomo, Governor Cuomo, he called New York an employment first state, but there really wasn't the support of the governor and the state as a whole. And so while I don't doubt, and I've observed OPWDD making great changes, I'm wondering if you are seeing a real difference in the governor's office around support.
Yeah, so I think, and thank you for the clarification. So not talking about last year's budget, but 10 years ago when we tried this the first time. So I do think that there is a renewed commitment. I do think that this governor has made it more of a priority. She's built up the office of the Chief Disability Officer. They've staffed up even more in this budget year. She's recommitted to issuing a new Olmsted plan, and I know that we have talked to them about the importance of building in as much independence as possible for people, which of course includes employment. And there's a lot of discussion happening at the executive level. So I do think that there is a higher level of commitment this time around.
Thank you. Does anybody have questions for our committee?
Susan, quick question for you. This is really for probably Abiba and Alexis. Is there a formal recognition of entrepreneurship as employment?
I don't believe so. That has come up quite often, and often entrepreneurship is left out of employment, which is why we are specifically including it. But there may be folks at OPWDD who know that better than I.
I think we'd have to take a look at that, Nick, and get back to you. I know that there have been some efforts to support entrepreneurs, but obviously that number unfortunately has been pretty small. But let us look into that and provide some feedback.
Thank you.
Thank you.
When Susan, you mentioned entrepreneurship, I just wondered whether or not the actual initiatives included that. I know Tom has another question.
A few comments. First of all, thank you to OPWDD for paying some attention to this area and starting to ramp up their efforts. I've got a couple of comments. Number one, when you look at day habs, from what I'm seeing, they have drifted away from the original concept of preparing people for employment, and in many cases are not providing much in the way of progress. Secondly, as I'm understanding the restrictions on ComHab workers, they cannot be job coaches. I'm not quite sure why, but I would like to see us address that issue. We can't just rely on Access VR. Access VR is dealing with those who are functionally independent. There is a huge number of people who are not functionally independent, who need a job coach forever, but who can work. Maybe you can have 3, 4, 5 of them working together with one job coach. But those job coaches are not available. I know you have a program that deals with it, but it doesn't seem to be going far enough. On the other hand, the ComHab workers who are familiar with their individual clients can be job coaches. Not every one of them, but many of them. So I'd like to see OPWDD address why we can't use ComHab workers. Do we need a change in federal rules? What do we have to do to get all those ComHab workers out there giving meaningful activities? The third point is, and I don't know that OPWDD can do this, but maybe you can help identify who can. How do we give employers supports? I'm speaking here from a little bit of experience because I've been working with Westchester County on this very issue. And what we found is employers feel overwhelmed to take on somebody who is on Medicaid. There's all kinds of reporting. There's all kinds of calculations that have to be done every month to make sure they don't go over the maximum income and all kinds of things. And so how can we get somebody in the state to work with there are statewide various groups that are doing this, that are helping and support employers, but they're few and far between. How can we make this part of the effort? We need calculators, online calculators. We need experts who can provide advice. And I'm not quite sure where this should go, which department it should go in. And then we need training for support brokers and for CCOs, I guess, in this very issue. Because it's okay.
Sources on benefits. And I know many of the agencies that offer supported employment also have people who are skilled in helping the individual understand the benefits and the impact of their income on benefits.
I think that's very helpful, but I think employers are scared to do this. From what I've seen, it's Amazon and a couple of other really large employers, and then a whole bunch of bakeries and small employers who are employing people with developmental disabilities that are in that middle group of people. And lastly, I think we've got to find a way to implement some of the good things that we're talking about. Changing the principles is important, but we need to implement this some way. I don't know how OPWDD gets that done, but there really has to be concentration on bringing down the principles to the local level and maybe partnering with local governments, with counties in particular. And let's get back to a partnership that we started to have many years ago, but was dissolved because many county executives did not want to be involved. Well, now I think we need to have local government. It can't all be OPWDD by itself. It needs to have, they need to have partners to implement some of this stuff. Thank you.
And just to help, you know, we do work a lot with LGUs and other local governments in different ways, including in the crisis space, which was spoke about earlier. But we also meet with the reps on a regular basis as part of our work in the interagency, the IOCC, where we work with OMH, OASIS, OPWDD, and the LGUs and CLMHG. So we are doing a lot of work with counties, and our regional office works with them on a regular basis and meets with them too. So I just want to clarify that we're doing a lot of that work. Obviously, it takes time. There's a lot of different conversations happening, but we are definitely engaged with, county reps and local government units. And you can read a little bit more about it in our annual report in our 507 too, where we kind of speak about the different activities going on with different stakeholders and representatives.
Thanks, Jessica. Susan, anything else? Shamika?
That's it for me.
Okay. Shamika? All right, let's move to self-direction. And Gary or Stuart, can you hear us okay?
I can hear you perfectly.
And some good news, Stuart, is that with Suzanne joining us, we actually do have quorum.
That's
So I know
excellent.
Action has some recommendations that you'd like to make, and they have been distributed. Yeah, that's right. Tom, do you want to move the minutes? All right. Do I get a second on the minutes? Very good. Sumantra, good. Okay, so we've approved the minutes. Take a vote. Yes, all in favor. Okay. Any objections? Okay. All right. Stuart.
Yeah, so I take it I'm going to highlight the three recommendations, and then we're going to take a vote on it. Is that correct, Nick?
Yes, and anything else part of your report, correct?
Okay, any questions that may come of this? Okay, so our committee has been working for quite a few months on coming up with recommendations. We started with pages and pages of bullet points. We ended up with paragraphs and paragraphs of bullet points brought together. And at the end of the day, what you're looking at here through a process of some coaching from the executive committee and from the amount of time that we spent working on our recommendations and from some guidance from Office of Strategic Initiative and the other folks who you all know have been working with all of our committees, we've come up with three recommendations. And all three of the recommendations all require OPW working with our committee to achieve what we think are legitimate recommendations based on all of the discussion that we've had. The first recommendation, I'm going to read it, although I'm sure all of you have read it and thought about it, and you may have jotted down some questions. There are several self-direction checklists that have been utilized over the past several years by various participants in the self-direction process. And they include checklists for brokers, support brokers, fiscal intermediaries, care managers, circle of support, and if I missed anybody, please let me know. But they're all the key people that help make this work. what we have found is that they haven't been consistently utilized across all of the regions. And our goal was not to reinvent the wheel, but we think that there's some very good substance in each of these checklists. And we believe that many of the items on the checklist aren't made aware to the person who would fit that particular category, that particular checklist. So we're proposing that we work together with OPW to make sure that all of these checklists are utilized and signed off by every region when a startup budget is submitted to the DDRO. And the requirement is that the individual fiscal intermediary all are acknowledging that information. I can tell you with some certainty that I've seen some of these checklists submitted without signature pages. So I think we need to have one uniform way of making sure that all of the participants are all doing what they should be doing so that everyone knows what the process looks like. The second thing within that first recommendation is that many people speak many different languages in New York State, and we have found that many people go through self-direction not understanding what is self-direction, not understanding what the process is, not understanding any of the 5 checklists that I alluded to. So we feel, and this is going to be a little bit more difficult, that the language that is the person's primary language should be the language that these checklists are in. The second recommendation is that OPW will partner with the Self-Direction Committee of the DDAC to develop information and training for people in self-direction and their families and circles of support. The goal here is so that circles of support and individuals have a better knowledge of what their self-direction plan looks like, and that they're continuing to learn as the system changes to some degree. I could go into details and provide some bullet points, but I think the overall goal here is that people need to be involved in the learning process. And we feel that by working with OPW, we could help mutually create some of those learning processes. The third recommendation is that OPW will partner with us to raise the standards and quality for annual reauthorization of support brokers. Currently, support brokers are only required to have a minimum of 12 units of participation in the equivalent of a CEU program. There is no testing of that knowledge. All you have to do as a broker is have to attend, and that gets you recertified. And we feel that we need to raise the standards. We need to allow more competition within the support brokerage world, to allow more people to do more of the important roles that are required for self-direction to be sustainable. And those are our 3 broad recommendations.
All right, thank you, Stuart. I know these recommendations were reviewed by the executive committee and approved to be sent to the council members. You should have all received them. Any discussion? And I ask for a move to accept the recommendations and move them forward to OPWDD.
I move to accept.
All right, well, I'll take Suzanne's first, and Barb, I'll take you as a second. And all in
Okay.
favor? Aye. Any opposed?
Aye.
Any opposed? No. Okay. Recommendations are put forward to OPWDD. Thank you.
Thank you.
Stuart, anything else for self-direction?
Well, our next step in the self-direction committee, now that we know that there's going to be a formal response to our recommendation, will be for us to be on the lookout for how we will work with OPW on this. And then the other thing that we're going to be working on in our committee is we hope to have the self-advocate survey finished soon. These recommendations that I propose today are coming from our Sustainability and Equity Committee. And so stay tuned. We have a lot more to come.
Great, thank you, Stuart.
This is Barb, hey, Nick, this is Barb DeLong. I don't know if it's appropriate, but, and I know it's something that the Self-Direction Committee can't comment on, but maybe people from OPWDD can, because it's a recent issue that's surfaced here in Western New York regarding self-direction, and it's rather of an urgent nature. Can I ask the question, or is it inappropriate?
Ask the question, Barb.
Well, you know, and I'm not an expert on it, but I'm hearing a lot of rumblings from people that are served through the self-direction process, that all of a sudden, and there's about 6,000 people at risk in Western New York, at risk for not getting their funding. So the contracts are not being funded appropriately, and all the providers are out of money. And there's things like rental subsidies and, you know, things like cell phones or computer IT services, a whole list of family support services, and there's no money. And so what are these individuals and providers, because the FIs can't give them the money if they don't have it. And so effective April 1st, it sounds like to me, all these individuals being served are not going to be served. And is this something that's just misunderstood? Or is it reality? Because I'm hearing that it's completely understood in Western New York and people are freaking out.
Yeah, so Barb, I think that this is it's a complex question, and I don't think.
Okay.
We'll let Willow, do you want to take it? Or do you want to be the?
Oh, yeah. I can't hear you.
The state contract portion of self-direction plans, and it's a known issue.
Yeah, I mean, I think
it is a known issue.
I think that there is a known issue that is a piece of sort of what you relayed. Certainly not that 6,000 people are about to be without services, though. So I will give Abiba the chance to answer in full.
Well, you know, I may exaggerate to make a point, but you know me, that's Barbara DeLong. But I just, you know, it's really disconcerting for some of the individuals and the families because they don't understand all the complexities and they're at a loss right now. So go ahead and respond, and then I can follow up with any questions or clarifications I need outside the meeting.
Yep.
Yeah, Barb, we had essentially, we held a webinar, I believe last year, the year before, last year, really outlining to the FIs, you know, their obligation and responsibility to the monies that are allocated in their contracts, right? And really laid out for them a series of steps that they're required to engage in, you know, including managing within the contract, working with regional field office. So for the providers that are highlighting this as an issue, I suggest that they reach directly out to the regional field office, right? Because, you know, every circumstance varies and we really need to look at the issues. But bottom line, what we've noted to the providers is really, number one, managing within their existing contract, and to the extent that there are concerns, proactively reaching out to a regional field office to identify the issues. And so I don't want to get into the specifics here without knowing all of the facts and who the providers are. But Barb, if you want to have the providers reach out to regional field office or myself or Anne Marie, we can certainly have the Region 1 office be in touch with providers to look at the specific circumstances.
All right, we'll follow up this week, and actually I'll get myself involved as well to represent the families and individuals. Okay? Because you know I'm like a dog with a bone. I won't let go. All right.
Thanks, Barb. And again, you know, I would encourage, I know this has been an issue, and perhaps the self-direction committee could report out on this in the next meeting, but I do know that that this does not affect everybody who has self-direction. As Willow said, this does affect a few people who either have new plans pending or have existing plans where there may have been a change. All right, any other items for self-direction? Do we have a question here? Yeah.
I didn't know if I may report out on the self-direction survey.
What is that question again?
Did you want to report out on the self-direction survey?
Who's asking that question?
It's Gail Pato.
Oh, hi, Gail. Sure. I mean, we can, if we have time. I mean, my presentation was very short. Why don't you take a couple of minutes and talk about the self-advocate survey that you're spearheading?
Sure. There is a small subcommittee of individuals from the self-direction subcommittee that has been working on a survey specifically geared towards self-advocates with the goal of learning about what's working well and what's not working well. We've taken the liberty of dividing a survey into 5 sections, including general information and demographics, circle of support, care management, support brokers, fiscal intermediaries, and staffing. This way we can manipulate the data. We have about 52 questions, 51 of which are multiple choice. 1 is an optional narrative. And we're looking into allowing participants to be able to save and return to the survey rather than split it into multiple parts so we don't lose the value of the demographic information. We tried very hard to use simple language to address all the questions. The information, as I mentioned, we collected in the demographic area is specifically around who is taking the survey, so we can separate out responses specifically from self-advocates, as well as where they reside, the region, the CCO that they're working with, age range, living situation, and actually how long they've been involved in the self-direction program. So we can understand several different viewpoints as we look at the data. The questions are designed to help identify the sustainability of the program, and it is, we are trying very hard to make sure that we have the CM involved, the care manager involved, the brokers, FIs are teaching people how to use and manage their budget so that it can be a sustainable method of service delivery, and that the services are person-centered. So we've been working on that. We've concluded the draft of the survey and are ready to move on to next steps to see how we can deploy that across the state.
So we hope to bring it to the council within the next couple of months.
Thank you, Stuart. Let's move on to systems quality, data and service delivery. Dolores? And Jerry. I know Jerry's on virtually.
Yes, so, and Mike will jump in at any point. So a couple of years ago, we made a very lengthy list of recommendations to improve the front door info session process. And we're very happy to see that most of those recommendations have been incorporated into the redesigned format and content. So we were able to preview some of those videos during one of our meetings, and we're very happy to see the quality, very happy with what we saw. And so kudos to OPWDD for taking the time and the effort to redesign that entire process. I think it's going to be much better. So over the past couple of months, though, Michael and I have been really struggling to redesign our committee, restructure our committee to incorporate the expanded scope that we now have. So it's been very challenging, as I said. We've decided that we want 2 subcommittees. So the first one is going to be qualitative subcommittee, which is really continuing the work that we have been doing on quality, focused on anecdotal reports, applying practical and common sense approaches to improve how people experience the system. So that's a continuation of what we had been doing. Now we're adding a quantitative subcommittee, which is really the OPWDD community of practice, the data community of practice. So we're adding that into our committee. And that's focused on key metrics and performance and process measures that are currently available, and then looking at what's needed to improve the system. So what we've determined, well, the committee is forward-looking. We're looking at how we can shape the system of the future. So what we've really concluded is that we need to have a vision to start with. And that vision can't be our subcommittee's vision. It has to be the council's vision. All the committees have to be involved in this, and the full council. So once we have that vision, then we can determine a framework and get moving. But we have to have that first. So that's kind of where we're at. So stay tuned. Michael, do you want to add anything?
You covered it very nicely. This concept of a vision, I think, is really important if the systems committee is going to be functioning in what I think is the intention of what the DDAC has in mind for the system, for the committee, and how it should be functioning. It's, someone described it as a bit of a weather vane, if you will, or maybe pointing toward a true North Star, if you will, of where we want the system to go in the future. That's going to have some other input beyond probably just the systems committee itself. So we're having some internal conversations with a few members of that to pull on specific expertise to try to gather ourselves and have enough of an understanding of what we actually know to date, including the recommendations, extensive recommendations that were put forward by the committee previously. And we hope to be having a bit more of a plan on how we will be moving forward, probably to engage some of you in that future as well. So stay tuned on that as well.
Good. Discussion, questions? Okay. Thank you. Family Support Services. Yeah.
Thank you. It's a little backwards because we actually meet tomorrow. So I either present on information that's 3 months old, or I give you a sneak peek about what you're going to hear about tomorrow. So I chose to be forward looking. Tomorrow, we do have a lineup of different things that we'll be reviewing and having discussion around. As many of you, I'm sure, know, in July of 2022, OPWDD released a Family Support Services Administrative Memorandum around the reimbursement program that made significant changes. Recently, they conducted a survey specifically to FSS providers about their experience and some other information regarding those changes. So we're looking forward to a presentation by OPWDD tomorrow on their survey results. Additionally, we'll be hearing from several subcommittees. They've been working on a number of different things. Our stakeholder engagement subcommittee has been working on a needs assessment survey that was conducted from the beginning of January throughout the end of the month. They'll be sharing, I don't want to unveil all of their exciting news, but they'll be sharing a little bit information about what they were able to capture, who they were able to reach, and some of the comments that were shared through that process. That needs assessment is being done to drive a request for proposal. There's about $3.5 million in OPWDD funds that we're looking to redistribute around the state. And so the needs assessment is designed to identify the priority areas in each of the regions throughout the state so that that request for proposal can move forward. We're also very pleased with some of the information sharing. There has been a little bit of a lag on getting information from OPWDD in the past. However, there's been significant strides to partner and collaborate to make a change in that. And we're excited to see some of those and hear about some of those results tomorrow, as information sharing is critical for a request for proposal process to actually take place. We did work collaboratively with some different providers to come up with a template that we shared with OPWDD of required information that many of the members will need to be able to be successful throughout that process of identifying need. So we're looking forward to that. And the last thing we will be talking about, we have a reimbursement subcommittee that will be presenting on some recent clarifications that were made. And that would conclude tomorrow's program. So hopefully you'll tune in and get all the details. And I've left enough cliffhangers to make you want to do so.
Thanks, Gail. Any questions? Okay. Advance the slide. So again, I want to encourage members of the council that want to participate in committees to let those committee chairs know of your interest. We appreciate your participation. The committees is where all the work is done, so we appreciate the involvement, the hard work. A lot of meetings are held in between these quarterly DDAC meetings, and we know that there's a lot of collaboration going on right now with OPWDD, the liaisons, OSI, so we appreciate that work. I also want to thank everybody for attending this meeting. We were able to achieve a quorum, which is great because we were able to move forward the self-direction recommendations. I just want to make sure that everybody understands that, again, we can only count for quorum those members who are at the designated sites. People who participate virtually, unless they themselves have a disability, cannot get counted into quorum. So we need members to make every effort to attend the sites. We've set them up across the state. We're working on getting them to work a little bit better with those sites. But again, we appreciate your attendance. For our next meeting, the EC is going to be looking at our bylaws. Dolores has already started a lot of work on that. We're going to continue that focus. Our next meeting is dedicated to kind of looking at both the bylaws and some operational procedures of the council. Before we make any changes or recommendations to the bylaws, obviously they would be reviewed with OPWDD and also sent to members 30 days in advance of our next meeting. So depending on the progress that we make, we may or may not be able to achieve that, but we will let you know. We're also going to be considering the role of the DDAC in reviewing regulation. We know statutorily we have a role in that, but it's been somewhat of a challenge because there's a lot going on, and some of this regulation can either be consequential or it can be more updates, and we want to be able to sort through that. It's something the council has wrestled with for many years. But stay tuned as the EC looks at that. Right now, I'm going to open it up for discussion. Jessica.
Sorry, I just wanted to add, because a few times today, care management has come up and care managers, and I just wanted to remind folks that we have actively a contract underway for an independent evaluation of our care management program and care managers. So I know some people mentioned potentially doing surveys and stuff like that. So we'll be doing a lot of that work as a part of that evaluation. So don't spend a lot of time and energy of your own because somebody else is doing it, but we can touch base, OSI or other folks from the agency that are working in that space before you spend time and energy doing that. But we look forward to your participation in some of those opportunities as well.
Thanks, Jessica. Any other discussion? If you have any.
One of the issues that I hear a lot about is a little bit of a controversy over community classes. I don't know if any of our subcommittees are looking into that issue. I'm not seeing anybody responding back. Yes, it is.
Or is that something that's come up in self-direction?
Here you go, you need this.
Stuart, did you hear the question?
Yeah, I heard Tom ask, but I did not hear it. Then I heard someone else speak. I don't know what that response was.
Sorry. So the question that Tom asked is that, there's been some concerns raised regarding community classes, and I know that's specific to self-direction and the reimbursement of those classes. Is that something that you wanted to comment on or ask a question on?
Well, I think the challenge here is that the self-direction committee, it's really not, we're aware all of us on the committee, because we're all involved either with kids who are self-directed or young adults who are self-directed, or we're providers or physical intermediaries, everyone in our committee is aware of what you're talking about, Tom, but unless I'm speaking incorrectly, we don't at the DDAC get into that kind of detail. Now you're going to say, well, what are we supposed to be doing? Well, that's a different discussion. We will be talking in our committee. As you know, we knocked out one of our fourth recommendations, which had to do with fiscal intermediaries. We knocked it out so that we can, when I say knocked it out, we did not present it because we thought it needed more attention. So there are some things that we can do as a committee and on the DDAC, and then there are many things that I think that are better approached by other entities. I don't know how else to answer that question. I mean, we're not, you know, even though the commissioner mentioned earlier that she used the word advocacy for the DDAC, but I'm not convinced that that's our role to be advocates.
Stuart,
Yeah.
ask Willow maybe to comment.
Yeah, sure. So two things. I know we mentioned the self-direction evaluation that we just are about to launch. Obviously, that would include everything, including how community classes has been rolled out and what, if any, changes are recommended as a part of that. But what I also will say is, I know we hear a lot of chatter about confusion about community classes and changes in community classes. We never actually changed the rules. I know that there's a lot of misinformation circulating. We've talked publicly about guidance coming out soon on the community class issue, on the need for a real community of practice amongst FIs in the field in terms of approving community classes and making sure that the rules that are in our waiver agreement with CMS are upheld in approving those community classes, and in the sort of informal dispute resolution process when people think that they have been mistakenly denied a community class. So more coming on that, but we have talked publicly about that.
Thank you. I know that the commissioner did mention that they were doing that. What the issue is, for those who don't understand what the issue is, right now, those people in self-direction who are looking for meaningful activities during the day have very limited choices. From what we hear anecdotally, that the day hab programs are pretty much full and do not have room for additional people. And many of those in self-direction are not satisfied with what they're getting from the day hab programs. So they've looked for something else more meaningful. And the original concept of a community class, as I understand it, was that a person in self-direction would go to the YMCA and take a class that everybody else is taking, or go to the community college, et cetera. But what we've found is that there's pushback at those places. People with behavioral problems or issues are not necessarily welcome. At the community college, they're not willing to provide additional support, but OPWDD is saying, well, you can bring a day hab worker. And then the community college says, well, you can't have the day hab worker sitting, the ComHab worker sitting in the classroom because that person is not paying for the. So now we've got all these different problems of trying to access what's out there for the general population. So what has happened is various places have started to set up their own classes that are friendly to people with developmental disabilities or intellectual disabilities and have behavioral needs. And now we find that some FIs are saying those are not really community classes because they're basically filled with people with developmental disabilities. Okay, so now you've got this, the general world won't take the people with disabilities, and you can't go to a classroom that has mainly people with disabilities in it. Where are they going to go? So they're going to sit home and do nothing. So some places have found a way to open those classes up and encourage other people to come into them. A lot of them have not been able to do that. But I personally find it strange that the recommendation is that you can't go to, or the position is, you can't go to a classroom that's open to the world, but just happens to have only people with intellectual disabilities in it. But it's okay for you to be segregated in a day hab program, which is designed only for people with developmental disabilities. So let me say that again. You can't go to a classroom that's open to the world, but ends up only with people with developmental disabilities. But you should go to a place that's designed only for people with developmental disabilities. That seems to be totally contrary to the whole purpose of what we're doing, of trying to integrate people into the community. And I think that's the issue. And I don't have an answer for you at this point. I do know there's a lawsuit out in Long Island, which is progressing, where there was one person denied reimbursement for a community class, while 5 other people in that class were reimbursed through a different FI. And so that's that question that you're addressing of how do you get uniformity. But I think the bigger question is, what do we do for meaningful activities? One of our committees is talking about that during the day, when day hab programs by and large are just not meaningful to a lot of our people. And there's no other alternative out there. That's what I see as the bigger issue. I'm not sure how OPWDD addresses that issue or how we address that issue, but I think it's something that's important today and is going to become even more important. I'm understanding that about half the people who get services from OPWDD are under the age of 21. So we're talking about a lot of people coming online in the near future who are going to be looking for meaningful activities during the day. Employment is one thing, but everybody's not going to be employed. So thank you for letting me make a little speech on this, but I want to bring everybody to understand the bigger issue that we're facing.
Yeah, and I think, at the heart of it, day hab is intentionally different than a self-directed community class, which is also different than an employment program, right? But I think it's a really important conversation for the subcommittee. I think, as you've noted, our demographic is starting to trend younger, and we do need to sort of reimagine what those meaningful activities look like. So I think that's an important discussion.
Nick?
Thanks.
Michael. Could I just weigh in on this for a second? I think what Tom's articulating here is a symptom of something larger, which I think actually is very much in the purview of the DDAC. And what I think the symptom is that is that we have built a system that is almost exclusively now paid for through the Medicaid program, and the Medicaid program comes with certain restrictions, quite a lot of restrictions. I've oftentimes referred to that as the golden handcuffs, and it is a very strict interpretation, and you have rules that define what is allowed and what is not allowed in, for example, a self-direction program versus a day hab program, et cetera, et cetera. And I think we as a system should be constantly evaluating the degree to which we continue to have Medicaid be the almost exclusive payer of services when it comes with these restrictions. People are not square. And that, I think that's the dynamic that we have, is that there are people come in shapes and have curves and things like that need to be accommodated by things that are beyond a very regimented, strict service delivery system with rules that are very, very strict. And that's where, for example, state dollars really can come in and augment or supplement what's available to be funded through the federal government and the Medicaid program. And I think that's a conversation for us to have as a system over the next several years about the degree to which we continue to allow us to use Medicaid as a verb in the state of New York rather than as a noun to Medicaid everything in sight. I think that becomes a problem at some point, and I feel like we have started to go beyond the point at which we should have maybe started to go, wait a minute, hold on a second, we need to reevaluate this. And when the issue, when this issue was raised in the self-direction committee, which I was a guest at earlier this week, I guess that was, or maybe last week, there was discussion about the community of practice concept that Willow mentioned. And I'll just say that the expectation, I think, is fine, but I think it cannot be an expectation that FIs participate in a community of practice without some kind of adjustment to the FI rate. That has to be a corresponding dynamic and you can't just kind of say, well, everybody's going to have to do this. Well, wait a minute. There's a cost of everything, making sure that that ASL interpretation is available to everyone, for example. It's another piece of the accommodation that I think we need to consider as we try to fix problems with the system like this. Thanks.
Randy.
Nick, if Randy is speaking, we can't hear her. I'm sorry.
Sorry. All right, the mic wasn't on. My apologies. I heard recently that OPWDD was working on a statewide database that would match individuals seeking residential placement with providers, and I was just curious as to the status of that and when it might become available.
Yeah, Randy, we're still working with our IT folks on establishing that platform. It's actually part of the Certified Residential Opportunities ADM, which was issued for public comment last year. And so more to come on that. It's premature to kind of give definitive timeframes because we're still working on the build. But as we get closer, certainly we will be providing updates and there will be opportunities for folks to be trained, especially the end users, providers, care managers, et cetera.
All right, thank you, Abiba. I'm really happy to hear that because some years ago, probably, I don't know, 10, we had this discussion at the Hudson Valley DDRO where there was a whole work group working on a database just like this. So I'm really happy to hear it's going to come to fruition.
Yeah, we're super excited as well, hoping to have some much needed efficiencies. So thank you.
Sumantra.
Can you hear me now? Okay. Just to add to that about the matrix, we had some discussion about matrix and data. I'm a part of the OPWDD's data governance team or something. I was supposed to be. I met up with them twice, I think. They have started putting up some data on the website, and I was just, they showed me something under About Us. They're putting a data link in there. So there is some data that's available, and I'm going to have a meeting again today with them. They are trying to, so we are trying to work on some matrix as to what it is. So I'm supposed to be the interface to understand what they're presenting. So this data is slightly better than what we had in the past. Still not that granular. It's work in process. They're trying to extract data from these individual systems, whether they have the data, they're still not sure, and they're trying to make a data warehouse out of it. They're really working hard. I'm meeting up with the CIO also today, possibly. So there is work going on, and we will keep you posted.
One of the comments that I've heard is that in some cases, the system worked better when the counties were involved. Not everywhere, but some of the counties were fully involved. They were able to keep track of who in their county was looking for housing and what vacancies were available. Going on a statewide basis means that somebody in Long Island can end up being placed in Buffalo, far away from family and the communities they're familiar with, which in my mind is not a good idea. So can I suggest that maybe you take a look at the concept of ensuring that this data can be broken down on a regional basis or a county basis or even a smaller basis if possible. If somebody is from Southern Brooklyn, they would prefer, I think, to stay in Southern Brooklyn, and New York City is a big place. They don't want to live in the Bronx. They want to be in Southern Brooklyn. And Westchester, people, maybe they'll go to Putnam County, but no further. So, and I can't speak for upstate, but if we can ensure somehow that, it's a very short distance to go visit your relative at a group home. And then secondly, what are we doing about all of those people who don't want to be in group homes? I'm understanding that the last time we saw a list, and we've never heard an answer to the question that we asked last time of how many people are actually waiting for group home spots. The last letter that I saw from OPWDD was about a year ago or maybe more. It said over 5,000 people. And so what are we doing for those 5,000 people? Where are they now? Are they in homeless shelters? Are they in somebody's home? Where are they? And then what's happening to the other 5,000, 10,000 people who aren't on that list and want independent housing? What plans are we making for them? I don't know how you get them into the database because I don't think most of them want to be identified. They don't want to be on a list being sent to a group home somewhere. It's not their choice to go to a group home. Group homes are fine for people who want to choose that lifestyle.
I just want to touch on
Right.
piggybacking what Tom has mentioned, because I am also hearing about individuals looking for services, but it's my understanding that OPWD is working on backfills first. So if we're going to be if I'm piggybacking on what Tom says, where are those people going to be based and how far from family? Because if backfill is in Buffalo, what happens? Because my thing is we're supposed to be about putting person within their community where they're familiar. So if the backfill is not within the community where they're familiar, what's OPWDD's plan?
And vice versa, people in Buffalo don't want to go to Long Island. Let's.
Willow, can I just jump in for a second? This is Abiba. I just want to note fundamentally that we don't place people. The Crow contemplates, and the Crow again are for people that have stepped up and noted that they are interested in a certified residential opportunity and need that level of support. If somebody isn't interested or needs that level of support, then obviously they shouldn't be on the Crow. But we work collaboratively with our providers to really look at the needs of every single individual and the resources that that setting has available. And the family is a part of that discussion and making a decision as to whether or not they want to choose that opportunity. So I just want to be clear that we're not intentionally pushing or placing people away from their families, that it's really a collaborative effort. And I'm not saying it's a perfect system, but it's important to recognize that the family has a choice and an option. And I know that sometimes those choice and those options are limited, but the goal is certainly to make sure that there's input, feedback, and collaboration among the team, looking at the resources that are available. And we can certainly talk more about the Crow process and the requirements when we get closer to issuing the ADM. But it's really important that when we talk about certified residential opportunities, that we're really speaking about how the process really operates, how it's intended to operate, and the components of the process.
Thanks, Abiba. And I'll just add on the data piece of your comments. We actually on the website have the Medicaid data book. There's a lot of interactive dashboards that launched this year. You can pull up information by region. We've spent a lot of time and resources making that data available and as usable and transparent as possible, and we continue to work on that. So I think the community of practice data conversation in your subcommittee will be really valuable.
I just want to make another point out here now to Tom, to your point and the meeting that we had with the committee. One of the things that it's sort of on the verge of how much data, how granular we want to be, and also protect identity. Now, there are counties that the numbers are so small, if you identify that, you get given. So there's a sort of a trade-off that we need to make and a conscious trade-off. So it's something like they were apprehensive about that. We asked them for data, but how much data can they give in? So it's an ongoing discussion. Nothing has been decided yet. And as you rightly pointed out, as of now, what they have presented, the dashboards, they were talking to me and they were looking for some interns also to help them out in Tableau dashboard, is basically more to do with financial data, the Medicaid, the values, rather than whether they're getting placed. So that's, I think, the second part of the conversation. To this committee, I think we should also prioritize, because it's a massive work to do. Now, we should also prioritize what type of data should we ask for them to give us small wins. It's an ongoing exercise, and being in the IT side of the field myself, it's something like it will take a couple of years. So if we can come up within a committee as to what are our priorities and look at OPWD priorities and come up with some top 3 or top 4 bullet points, that'll be good for both of us.
Thanks, Sumantra. I think that's got to be done at the committee level, right? And just an important note. So Kirk, I know Dan's not here, but the two of you maybe follow up with Abiba on the Crow ADM. I think it would be helpful for the council. I know that's come up a few times to be briefed on that. Okay, we need to we need to move to public comment. So before we start the public comment, I just want to remind everyone that this is an opportunity for the public to provide comment. The DDAC membership nor OPWDD will actually respond to the comment, but we'll certainly take that comment into consideration, both the DDAC as well as OPWDD in its future planning. I would also just remind everyone that does want to speak that this is a public forum. So, we recommend, again, sharing personal health information, and anything that you want to keep confidential could potentially be brought up directly with OPWDD. So.
Okay, so we're first going to start with the public comment. Any comments from around the room? Sure. You can go right up here to this mic.
I feel so honored that you're all listening to me. My name is Sarah Buchinger. I'm a self-direction broker, and I appreciated to hear everyone's feedback on self-direction. And I just came all the way from Rockland County to speak to you because I feel like a lot of people here could have an impact on the individuals I serve as a self-direction broker. So first, I want to thank everyone for all the dedication and the time that you invest in elevating the lives of these individuals, and it does not go unnoticed. However, despite appreciating substantial efforts invested towards improvement, there remains a crucial aspect of our system which still requires significant enhancement, which is the self-direction process. It's not to undermine the work that was done, but to acknowledge that to fulfill the promise of true self-determination, we must evolve further. So we have proactively compiled and submitted a document detailing 16 changes that we believe are vital. Today, I want to focus on 2 of these changes. So firstly, we want to recommend the creation of a dedicated deputy commissioner for self-direction. This role would not only oversee, but actively manage and cultivate a better self-direction system. The individual in this role must be an advocate for change, a bridge between policy and the needs of the people, paving the way for a more person-centered approach. Additionally, the establishment of an advisory committee comprising of experts who are entrenched in day-to-day operations within this field is essential. Their hands-on experience is invaluable to guiding the deputy commissioner. They should be central to the drafting of ADMs and the rulemaking process, ensuring that the realities experienced by individuals and families are reflected in the policies and procedures that govern their lives. It's puzzling to comprehend why state operations serving about 13,000 individuals have a deputy commissioner, but self-direction, impacting nearly 30,000 lives, is relegated to a much lower tier within our organizational chart. The second thing I want to talk about is the current rules that are excessively rigid, like we spoke about community classes, often resulting in a default no when flexibility and a person-centered approach is required. To cultivate an environment of solution-oriented support, we propose the creation of an official communication channel through which brokers and FI can directly present their inquiries and cases to OPWDD. This channel should not be a mere formality, but a dynamic, interactive forum where problems are given the attention they deserve, discussed thoroughly, and solutions are actively sought. By establishing a dedicated committee to review these discussions, we assure that self-direction is not a rigid, one-size-fits-all system, but a flexible, person-centered service capable of adapting to the unique scenarios presented by the community it serves. This is for sure something that we all think is very important, but the problem is that it takes a lot of time and effort. So we ask now, that being that the commissioner is going to be resigning in the next few months, maybe this could be one of the last things that she's putting away a lot of time and effort to make such a system for QA insurance. I want to just say 2 stories that I had as a broker that will illustrate why this process is so important. So first, I have an individual that is just left school and wanted to attend a transition program that was provided by a college. And it was a great program. The mother had told me a while ago that she's planning on sending him there. There is a part of the budget called transition program where we could get covered for that. One of the requirements on the IDGS chart is that the staff members at the transition program must have gone through background checks, which makes sense. Well, these are IDD individuals, we want them to be safe. However, in order for that to get reimbursed, the FI that this individual is with required that this transition program, the third-party transition program, should show proof of the names of the staff members that they were background screened. Now, I don't know if this is legal or not, but it didn't make sense. Why would the transition program provide such feedback? Now, the FI was nervous. How could we reimburse such a thing if it says on the IDGS chart that the people have to be screened? And we got an email from the transition program stating that the staff members were screened, but the FI wasn't happy with that. They said in the past, we needed proof in order to reimburse. How could we be comfortable? So I, as a broker, begged the FI, please reach out to OPWDD. And they said, no, we're not reaching out to them because we don't feel like we have a question. And whenever we ask OPWDD, they always tell us, go back to the guidance. It's your choice how you want to interpret the guidance. Now, there was also a real problem. We didn't know what to do. And this individual was already attending the program, and we wanted him to get reimbursed for it. Now, the only solution was the mother herself had to call up the local DDRO and start crying on the phone and saying, I worked so hard all my life for this individual, and now he wants to attend a transition program that's meant for him, and it follows all the rules. But this rule, the FI doesn't know what to do. What should we do? And that's how we got the solution. And the OPWD was nice, and they went to the QA department, and the FI got an email from the QA department of OPWD saying, okay, an email from the transition program is enough for a proof. Now, if there would be a regular process, I as a broker or the FI would be able to ask OPWD, explain the situation, and everyone would understand that this is something that needs to be taken into consideration. And that's how we would be able to solve this problem in a more dignified, respectful way to the individual, rather than the mother have to cry on the phone. The next story I want to say is that I have a client that's married. She has a developmental disability, but she's married and she has a few kids, and she wanted to get housing subsidy. However, her husband has a very high income, and she doesn't qualify for SSI or any benefits, but she also cannot work due to her disability. Now, what happens is one of the rules for housing subsidy is that you have to contribute 30% of your income or benefits towards housing subsidy. But she does not have income, and she does not have benefits because of her husband's high income. So you would say, why does she need the housing subsidy if her husband has high income? But he's paying out his ex-wife a lot of money, and then they're staying with very little money monthly, but this will not be taken into consideration when applying for benefits. So we applied for housing subsidy, but we got denied because she does not have a way of paying 30%. And we asked for an appeal. We had a meeting with OPWDD. We explained the situation. And again, it was denied. We thought we were going to have a meeting with central office, but we got a letter from central office from Abiba Kindo writing that it's denied again because there's no income. After a lot of phone calls and advocacy from my end and reaching out to the local DDRO and senator offices, we got the okay to resubmit the application with the husband's income. And they might consider it. We do not know yet. We're waiting, we're hoping. But is this a unique situation? Yes. Is there a process for such unique situations? No. That's what we're asking for. That the rules are not black and white. And like someone said here, not everyone is a square. Every individual is different. And we want this to be person-centered. I'm just advocating for the individuals I serve, and this is what I do all day. And I really appreciate if you could take what I said into consideration. And I also want to say that we established a group of brokers and self-direction professionals called Empowerability NY, where we're going to together advocate and propose positive changes to self-direction, because we feel that this is something that really needs assistance, and these developmental disabled individuals really need our assistance. I really appreciate all your help and listening to me. I would appreciate to hear any comments and responses. Thank you.
Thank you. Do we have any other members of the public? None here. Any online?
Okay, do we have any public comments from the Buffalo location? Okay, I think that's a no. Any public comments from the Syracuse location? Okay. And any public comments from the New York City location? Okay. Any public comments from the Long Island location?
No.
Thank you. Okay, so next we'll be taking public comments online. We have first Roy Probian. So I am sending a request to unmute. Okay, I don't know where you went, Roy. If you don't have a comment, I'll move on to the next person. Lori Scaller. So I'm sending you a request to unmute now, Lori. So once you unmute, then you can make your comment.
Thank you so much. This is Lori Schaller. Can you hear me?
If you could speak a little louder.
Sure. Thank you. This is Lori Schaller from National Disability Institute. So I want to champion OPWDD for taking steps towards encouraging people who have a disability to work to their fullest abilities. I wanted to bring to your attention that some of your OPWDD programs hire individuals and they receive a 1099 at the end of their year of employment, even though they really don't have the right to make any decisions regarding their employment shifts and things of that nature. They are not truly self-employed. And then I am meeting people across New York State who have indicated that their providers have told them that there is no need for them to file income taxes. People who have a disability who receive SSI and or SSDI who are employed need to file income taxes even if their income is below the threshold requiring that they file, so that eventually instead of receiving SSI, they will become eligible for SSDI on their own work record, and that will not impact their biological parents' retirement benefits in the future, because the person is forced, when the parent either retires or passes away, to, instead of receiving SSI, receive SSDI on the parent's work record, and often that reduces, in particular, the mother's retirement benefit, because there is a family maximum for a family, even though that adult individual who has a disability, a developmental disability, has not resided in that home for 20 or more years. And National Disability Institute does have a small business hub, and we are situated to help agencies and individuals who are interested in self-employment to pursue that, and that is at the National Disability Institute website. And then I just wanted to bring to your attention that I understand OPWDD does authorize provision of funding, so a person who needs a modified vehicle can obtain that, and the funding will cover the value or the cost of making a vehicle accessible. But the timeline of 6 months is too long for someone who needs that vehicle to maintain their present employment. We all need reliable transportation to get to our jobs each day for the most part. And I thank you for the opportunity to comment.
Okay, next we're going to move on to Marilyn Jeffrey. I'm sending you a request to unmute, so you can go ahead and unmute and make your comment.
I'm wondering about the lack of housing. One of the presenters talked about how OPWDD collaborates with families so that no one has to go into a group home that may be far away from their community. However, because of the lack of inventory, families are often desperate and they have to say yes to a long distance placement, which isn't in anybody's best interest. So because of that, many parent groups across the state have been trying to build and create non-certified housing for their families, or their loved ones, I should say. So who at OPWDD is collaborating with these parent groups to determine non-certified housing, what the requirements are on an individual basis, because they're all a little bit different, keeping in mind the settings rule and all of those things so that families can move forward and start to obtain funding so that they can build home ownership or rental properties for their loved ones with developmental disabilities. Thank you.
Thank you. We're going to move on to Ralph Warren. So I'm sending a request for you to unmute. Okay. We're going to move on to Michelle Mushlet. Sorry if I'm saying that wrong. Michelle, I'm sending you a request to unmute.
Can you hear me?
Yes.
Okay. I am a self-direction broker, and I do appreciate the self-direction committee's points that they are sending to be considered. I don't know if I agree with all of them, but I do agree with number 3, which is raising standards for the quality of self-direction brokers. But I don't think it starts with reauthorization. It starts with training. I have many times volunteered and presented at the broker trainings. It's about an hour that we are given. I do that. I donate my time, but I have often suggested that there needs to be an entire day's class taught by a broker, not by someone from OPWDD, explaining to these brokers the real life work that they're going to have to do and the ways in which they're going to have to do it. Brokers are completely unprepared when they leave their broker training. And they are sent out there to support families, and they have no idea what they're doing. And there are quote unquote mentor brokers, but we're asked to do that for free or a few training hours. I take plenty of training. I don't need training hours. I do the best that I can to offer my time to other brokers to help mentor them, but I also have to make a living. So my suggestion is that not only be suggested at the reauthorization process, but at the training level, that we need to start training brokers better. Thank you.
Thank you. Next, we'll take comment from Rhonda. And just a reminder, we'd like you to please keep your comments to 3 minutes or less, since we do have quite a bit of folks that like to comment. And Rhonda, I just sent you a request to unmute, so you can go ahead. You're unmuted now, Rhonda, if you can go ahead. Okay, we'll move on to the next person. Next is Catherine Hallett. And you can unmute, Catherine.
This question already in the box, but I don't think anybody saw it or responded.
I'm a parent and I'm also an advocate for other parents and I'm based in Brooklyn. I had a question about, I applied or I received notice from Braverhood in October that my daughter was eligible for OPWDD, and we've been waiting on care management placement since then. I was told that it's on average about 6 months to be placed. However, at this point, we still haven't gotten a placement, and I was told that to expect placement by May or June. I know that I'm at least one of at least 6 other parents in the same situation with the same exact timeline. Is this normal? And like, what can I expect? And what are some ways that even like it can be sped up, because this whole process has been almost like 3 years for me at this point. And then
Okay,
I might have one more question. Hold on. What or a statement. 1 second. I just need to, I had notes and I wasn't expecting you to respond, call on me right then. 1 second.
And I'll just jump in. I mean, we don't respond during public comment to specific comments or questions. What I will reiterate generally is that you have a specific issue for your family member, someone you're supporting, that you should absolutely reach out to your regional field office and see what assistance they can provide. The timeline presented did not sound accurate, so please do reach out directly offline.
Okay, that's exactly what I wanted to know. And then I think somebody already mentioned this, but I'm part of a large group at SUNY Downstate of parents that work with Dr. Hiddleman. And we've been getting, I mean, granted, I haven't, my daughter doesn't have OPWDD yet. However, we've been getting so many different confusing reports of like some people are their FI says they're eligible to go to, let's say, Disney World, and others say, no, you can't do Disney, but you can fly to Disney, but no, you can't. You can get the hotel for 2 nights at Disney. Just different examples of things like that where there's a lot of contradictions. And I was just wondering where exactly, like, can a parent find out more information on how to like properly negotiate and navigate the budgeting?
Catherine, if you
was all.
wouldn't mind
I understand
that
you
question
can't
in the
answer.
chat,
Yep. Okay, I can do that.
we can get you an answer on that.
And thank you so much. I appreciate you all.
Okay, next we're gonna move on to Rhonda. I just sent a request for you to unmute. Okay, Rhonda, I sent you a request to unmute. Okay, so we're sorry about that. We'll try to get you at the end. We're gonna move on to William Ludoff, and I've just sent you a request to unmute. William, are you speaking? I see you're off mute. Okay, I'm sorry, William. We'll have to move to the next person. Roy Probian, and I apologize if I'm mispronouncing that.
No, you did it perfectly, and thank you for calling on me again. I don't know if the commission is there, but I wanted to compliment her on the transition housing that they've set up in Brooklyn and Queens. I got started as an advocate for adults on that very issue of people bed blocking in residential schools. so that younger people who were in education and needed to get into the residential schools couldn't get in because they were full. So Kerry, you did a great job on that. I was not aware of it because it happened in the city. I'm on Long Island. I have to raise a couple of issues that are, I don't have any hair, but my hair's on fire. The governor's 30 days amendments includes a termination of CDPAP for potentially 5,200 people in self-direction served through OPWDD, like my 60-year-old son, Michael, my last surviving son, who all have lived at home all their life. And I'm his DR, and he will lose his respite care, overnight respite care through CDPAP if the governor's recommendation on the CDPAP reductions go through, which specifically affect folks with IDD. And somebody said, you folks don't advocate. Well, somebody better on our behalf with the governor's office, because this is a travesty. And, I'm 85. I can no longer take care of him, and I need somebody to be there overnight in case he needs changing, or head needs to be cleaned up, or he wakes up. It's just not right. He's lived home all his life, and I've had to care for him through self-direction. And so we need your help, DDAC. You are as close to the governor as any of us, or more so. So please help us out on this one. And any influence you can have with the governor on her offering 1.5% COLA to the not-for-profit providers who provide services for 85% of IDD folks in this state would be greatly helpful, since there was a 3.2 real inflation rate last year. And finally, the reason that people cannot get into day habs and residential situations that might be accessible to them is because of the workforce crisis, which was not mentioned here. The workers are paid minimum wage or slightly above, and so there's not enough staff so that you can fill up day programs. They're running at about 17% vacancy rate with a 30% turnover in the not-for-profit sector. And these not-for-profits were formed by parent groups at the request of the OPWDD by another name, when they began to deinstitutionalize the poor people who were living in those prisons, and they didn't do anything wrong. So thank you for listening, and I hope you all will help us out, because a lot of our folks are in jeopardy. The Willowbrook may be closed, but we're out here in the diaspora trying to survive and take care of our loved ones. Thank you.
Thank you. We have time for one more comment. Next is Ralph Warren. You've been sent a request to unmute, so you can go ahead and unmute.
Okay, can you guys hear me? Yes or no?
Yes.
Okay,
Yes.
great, thank you. Okay, I'm a self-advocate. I've spoken before, and I'll speak as fast as I can. I know there's not a response to this, but I'm really addressing the DDAC itself. I'm asking that you proactively ask OPWDD to do a formal presentation, as they have done in the past. I've been attending virtually most of these since 2019 or 2018. And in that range of 2019, they did formal presentations, both to here and the JAC, on the issue I'm going to be speaking, I'm asking you to address. And that is the rate setting coming up, both at the systems level and at the individual level. I'll keep it short. So the individual focus should be this. There's been discussion of by OPWDD in some settings of creating tiers for service authorization and funding that would be individually directed, presumably putting people in a large group called a tier. Some of us, in another context, some of my family advisory board for the CCO, we met twice last fall with OPWDD staff on the CAS. I'd rather not sort of misdirect your attention to the CAS because this is different than that. But they spoke and said they were working on creating service ranges, which is a little odd term because it's really about service authorization, and most times, most states call it tiers. It's very important at this point in the year, which will be the midpoint of this year, that the public hear about this and that you hear about it so that you can comment on it very directly. I do want to just say one thing really quick about the discussion of community classes. Jim Carp had mentioned in his public comment and a question to his public comment at the budget hearing a week or two ago. You know, and I looked this up, in New Jersey and other states I'm aware of, there are differences in terms of how the state's HCBS waiver is functioned and negotiated with CMS approval, obviously. They have a different process for that. It's the restrictions in the narrative that you've been given by OPWDD is not correct. And I'll back it up factually with information from New Jersey and elsewhere. It's very, very important, again, that on a very broad level, this body take up statutory issues as they become relevant and not just wait for a whole long thing. This is very, very relevant now because I would challenge anybody from, in a respectful way, I would challenge anybody from OPWDD to clearly present to you and to us, the public, basically where in the HCBS waiver, any of the appendix documents, any of the state regulations and codes, where does it give fiscal intermediaries specific authorities to make those decisions? The relevant analogy is housing. In the housing support, well, clearly the care managers and the FIs have roles in that process. Ultimately, it is OPW's responsibility to manage an appeal process. It's not left up to the FIs. We need these kinds of clarifications. Otherwise, quite frankly, it'll just generate more useless, wasted time, money, and energy in lawsuits. And, you know, I'm not trying to be complaining here. I'm saying, as I said in my very brief public comment, I'm just, you know, reaching out to other entities, whether they be federal officials, as I've done in the past, whether it be CMS staff at the regional office and other parts of CMS that deal with long-term care, as I have done in the past, to call attention to these things. The HCBS settings rule itself is not as restrictive as OPW has complained, has stated in this specific context. So, look, I appreciate the work of the DDAC. I encourage you to do more, to take on these responsibilities that you do have. Thank you.
Thank you. I'll turn it back over to Nick to close us out.
Thank you. And I want to thank all the members of the public for participating today and providing input. And again, if you have specific questions regarding yourself, a loved one that you'd like addressed, you can, again, as Willow shared, reach out to your regional office or put the information, you know, directly to OPWDD. I want to thank all of our members for attending today, and just want to bring up our next meeting dates. So our next meeting will be on June 11th, and then we have two more scheduled for the year on the 24th of September and on the 3rd of December. So again, thank you all, safe travels, and have a good day.
Stick. I'm freezing. I've been in here since like 9 and I'm